Hello and welcome to a new episode of DTV. We're delighted today to be talking about telehealth with Dr. Ed Lee. Dr. Lee is the Executive Vice President of Information Technology and CIO at the Permanente Federation, as well as the Associate Executive Director at the Permanente Medical Group, or TPMG. He oversees the technology efforts at TPMG, one of the United States' largest health providers, which includes being accountable for operational performance of IT, technology, integration, and digital innovation. His focus is on improving health information for both physicians and for patients. During the pandemic, he led the group's telemedicine efforts and continues to lead them today. Dr. Ed Lee, welcome to DTV. We're very excited to have you here.
Thanks so much, Avery.
So I'm really curious, how and when did Kaiser first get involved with telehealth? Because I know you were really early into working on this area. And also, how do you define telehealth, which is always an interesting question.
Yeah, it's a great question. And we probably should start with the definition, what we consider to be telehealth, so that we can have a good understanding of that. But the simple way I think of telehealth is using technologies to support and to promote the care of our patients when the patients aren't face-to-face with us. And so, a lot of people through the pandemic have thought of telehealth meaning video visits. And, of course, video visits is included into the definition of telehealth, but it's just so much more than that. Telehealth also includes things like sending secure emails, online chat, telephone appointments with physicians, nurse advice from our call center, remote patient monitoring, and e-visits. And so there's a large breadth of things that actually go into telehealth. And so if you take a look at that broad definition, we actually started telehealth over 20 years ago when we created our appointment and advice contact center, where our nurses provide 24/7, 365 advice to our patients through telephone. We started our secure email program, where physicians are answering emails directly from patients about 16 years ago now. And with respect to video, it's been about 12 years since we started that. And so we've got a decade or two of experience with our telehealth programs. And, as I think back, we started this decades ago because we felt it was the right thing to do for our patients. It just kind of fits in with our care delivery model that we have at Kaiser Permanente, which is, to leverage our integrated healthcare system to provide personalized, convenient, accessible, high quality care for our patients, and to ensure that our patients have the choice in the way that they receive their care.
It was interesting to me also, you talked when we last talked, you mentioned dermatology and how that using mobile phones, which I thought was a really interesting approach to telehealth, or an interesting application.
Yeah, I actually, we've been doing teledermatology, as we call it, for a number of years. And, patients have skin conditions, dermatologic conditions. And, a lot of times they don't necessarily care how or what way they get that condition resolved. They just want it resolved. And so for us, being able to leverage our integration to connect with dermatologists remotely allows us to do that in as quick as way possible. And so, a patient can get us, we can see a patient's skin condition in many different ways. One is they can attach an email, attach a picture to an email and send it to us. We could be in the process of doing a video appointment and they could show us a rash. Or, what often happens is I could be in the office in my primary care department and a patient could come in with a skin problem and I'm not quite sure what it is. I can take a picture of that and send it to my dermatologist who's on call and get basically real-time advice. And the patient can see the dermatologist immediately, which is always amazing to the patients because outside, sometimes it could take weeks or even months to see a specialist. And in this case, we're providing real-time care for dermatologic conditions.
And what do you see as some of the drivers? I mean, it's been going on, as you mentioned, for a long time, but it took an enormous leap during with the beginning of COVID, and now is kind of plateaued or is still growing, but from a much higher level. What do you see as kind of the drivers of that, and how are you able to respond to that incredible demand?
Yeah, with COVID, especially in the beginning, people were rightfully they were scared. There was a lot of uncertainty, a lot of unknown around what this coronavirus is. There were shelter-in-place orders, physical distancing recommendations, and people, they just didn't want to go outside of their house, even if they needed medical care. But telehealth provided an avenue for our patients to continue to get their healthcare needs met with physicians they know and trust. And so as things got rolling with telehealth, as people saw how easy and convenient it was to use, they kept coming back for more. So there have been studies that have been done that show that one of the best predictors of people who, say, do video visits is if they have done a video visit in the past. And so they get comfortable with the technology, they get comfortable with the idea that they can get that high quality care through a video connection. And so future video visits can be done in this way as well. And so for the patients who get their care through telehealth, that actually opens up capacity within our medical centers for patients who actually need to come in for in-person care, so that we can keep our medical offices safe with adequate physical distancing as well. So it's something that sort of builds upon itself and has been, as you mentioned, unprecedented growth during the pandemic.
One, I will tell you, as I mentioned, I think last time was my mother was a Kaiser patient, and the thing that I found interesting when she used telehealth was it's often the people that have the most difficulty getting into the medical office or the most in need of medical care, and that's what struck me is that you open up access to people that have got some sort of either some kind of disability that's either medical or some kind of other challenge, and telehealth really opens up a lot of possibilities for them.
Yeah, a lot of people have thought about it in the past in terms of telehealth, telemedicine is that it is for rural communities, patients who are, hundreds of miles away, that have difficulty accessing care. But while it can be used for that, and it is used for that, it's also for patients that you just mentioned, like with your mom, who has physical limitations of coming in or time constraints of being able to come in. And so healthcare is it's not a 9 to 5 type of thing. It happens all the time, and so being there for our patients is important for us. As you mentioned this, though, what comes to mind though too is that we need to make sure that our telehealth is equitable, that we're not increasing the healthcare disparities that are out there. And so paying attention to who understands and knows how to use the technology, who has access to this technology, and language barriers, those are all things that we're focusing on as well, where we can provide an iPad to a patient who needs to do a video visit. We have video interpretation services that are attached to our video visits application, so that language isn't a barrier. And so it's really important that as we continue to move forward with telehealth, that we provide this care in an equitable and inclusive way.
You've as you've mentioned, delivered, I guess, tens of millions of video interactions, or I should say telehealth interactions. What would be the priorities and for you for the next 18 months, and what would you recommend others focus on? Where do you see the big opportunities for gain going forward?
Yeah, I think we've talked a lot about outpatient care here, but we want to continue to develop a robust, comprehensive program that includes care of patients who are more acutely ill as well. And so we have a developing program, our telecritical care program, where our ICU physicians bring their critical care expertise, to the virtual bedside of the ICU patient, monitoring patients remotely. There is a developing space of hospital at home programs where patients who were traditionally cared for only within a hospital are being cared for at home in a familiar, nurturing, and healing environment. And an important component of that is remote biometric monitoring and remote video care as well. And I think another area that I'd like to see continue to work around is increasing our inpatient video consultation programs. We have a very well-established stroke express program at Kaiser Permanente, where any patient who comes into our emergency department or our hospitals who are suspected of having a stroke can get immediate video access to a stroke specialist, who can then determine whether a patient is a candidate for clot busting medication or not. And that's really helped get our what we call our door to needle times to being twice as fast as what the national average is. And so it's about, if I think about telehealth in general, with these programs I'm describing here, it's not moving people, it's moving knowledge and expertise at the speed of technology. And so that's really what excites me about the work that we're doing here.
I can't think of anything to add to that brilliant ending. I really love that, moving technology and knowledge to the patient. It was really good. Thank you very much. Thank you very much for your time. And for everyone watching, look forward to doing more conversations about telehealth. And thank you for joining us for this episode.
It's been a pleasure. Thank you so much.